Hello, I am Jareen Meinsinder, an epidemiologist with the Division of Biostatistics and Epidemiology at Cincinnati Children's Hospital Medical Center. On behalf of my colleagues, I'm here to present our publication titled Association of Age of Enrollment and Early Intervention with Emergent Literacy in Children Who are Deaf or Hard of Hearing. Learning to read is a crucial academic achievement for all children. Emergent literacy is the knowledge of reading and writing that children acquire in natural settings, such as the home. This foundation is vital to literacy development prior to formal reading instruction. Evidence suggests that young deaf and hard of hearing children struggle with emergent literacy skills compared to hearing peers. Because emergent literacy difficulties may lead to difficulty with later reading skills, it is important to understand how to support these foundational skills at an early age. Approximately 1 to 2 per 1,000 infants are born every year in the United States with hearing loss. This is an important public health issue as children who are deaf or hard of hearing are at an increased risk for language delays when interventions are not provided early. The Early Hearing Detection and Intervention, or EDI programs, have been established in all 50 states and U.S. territories to help ensure early diagnosis of hearing loss and subsequent intervention to help mitigate these delays. The Joint Committee on Infant Hearing recommends the following national EDI benchmarks. Screen infants for hearing loss before 1 month of age, diagnose hearing loss before 3 months of age, and enroll those infants with permanent hearing loss into early intervention before 6 months of age. The objective of our study was to evaluate the relationship between early intervention enrollment age for deaf and hard of hearing children and emergent literacy measured in preschool. Our hypothesis was that children who entered EI early, before age 6 months, would have a higher emergent literacy skills over time compared to children who entered EI later, at or after 6 months. In 2011 and 2014, emergent literacy was measured during preschool using the Get It, Got It, Go assessment, which was developed by the Early Childhood Research Institute on Measuring Growth and Development. This assessment is composed of 3 individual indicators in children's language and literacy development. Picture naming, which occurred in 1 minute, required the child to quickly name pictures of familiar objects found in home, classroom, or community settings. Rhyming, which occurred in 1 minute, required the child to point to one of 3 pictures that rhymes with the target picture, after all pictures were named by the examiner. And alliteration, which occurred in 2 minutes, requires the child to identify one of 3 pictures that starts with the same sound as the target picture. The scores for each of the domains reflect the number of items answered correctly and the time limit. This assessment was provided in the fall and spring of every school year. This study was part of a project that linked records of infants identified with permanent hearing loss who were born between 2008 and 2014 across 3 Ohio state agencies. Propensity score matching was done to balance the characteristics of children who entered EI earlier versus those who entered EI later, at or after 6 months of age. 276 preschoolers enrolled in preschool between 2011 and 2014 were included in the analysis. Complete matches were identified for 256 preschoolers, with 60% of children enrolled in EI by age 6 months. Mixed effects models were used to investigate the relationship between emergent literacy skill development and EI enrollment age. Picture naming is the number of pictures identified in 1 minute and is a marker of vocabulary. Along the x-axis, we have the child age in years at the time of the assessment, and on the y-axis, we have the actual scores, with higher numbers indicating more pictures. Children who were enrolled in early intervention early had significantly higher scores at preschool entry than those who enrolled later. This gap was maintained throughout preschool. The rate of growth, or the number of vocabulary words, significantly increased over time and was similar to the rate of growth of all Ohio preschool students in the state, using them as a reference. Here we see graphs for rhyming and alliteration, respectively. Children enrolled in early intervention early had significantly higher scores in rhyming and alliteration compared to children who enrolled in early intervention later. We also saw that there is a meaningful gap between preschoolers who are deaf and hard of hearing and all preschoolers, with the largest gap occurring in those who enrolled into EI later. Earlier EI enrollment may have lasting influences on child's emergent literacy skills in the preschool period. These findings are important because they highlight an area in which EI interventionists can help facilitate improved outcomes in the early academic transition. Integrating emergent literacy into EI programs can help children develop a strong and lasting foundation in language, literacy, and social emotional skills. Ensuring that children who are deaf or hard of hearing receive what is developmentally necessary is important to building critical foundational skills prior to kindergarten.